Hello everyone, I'm Dr. Prachee, fertility specialist, Ferty9 Fertility Center. Today I'm going to talk about the tubal factors in infertility. So first of all, I will explain you what is the function of the fallopian tubes. So this is uterus, but there are two fallopian tubes which are connected to the uterus. These fallopian tubes hang loosely over the ovaries. In a menstrual cycle, once your periods bleeding stop, the egg starts developing in the ovaries. Along with the eggs, there's an hormone called estrogen, which is produced from the ovary, which acts on the lining of the uterus, so that the lining is ready by the time egg is being released. Once the egg is released, the tube has to pick up the egg. So this is the function of the fallopian tube, that after it being released from the ovary, the egg has to be picked up by the tube. So how the tube is connected to the uterus is, from this end you can see this finger like processes which are called fimbriae. So the function of the fimbriae is to pick up the egg. So the diameter of the tube varies. Towards the uterus it is on the narrower side, and towards the part where the egg is entering the uterus or the tube, it's slightly broader side. But you can compare the inner diameter of the fallopian tube to the thickness of a hair. So it is that fine. Also, the inner lining of the fallopian tube is lined with cuboidal epithelium, which has cilia, means hair-like processes. So with the movement of those cilia, the egg is transported inside the tube. Once the egg is been released and picked up by the tube, egg is alive for 12 to 24 hours. So the sperm have to fertilize the egg within this time. When you meet, the sperms are deposited in the vagina. The sperms have to travel through the uterus, through the tube, and try to fertilize the egg in the fallopian tube. So the function of the fallopian tube is to pick up the egg, transport the egg inside the fallopian tube, also help the sperms transport towards the egg in the fallopian tube. So fallopian tube is the place where the egg and sperm meet in the body. Fertilization happens in the fallopian tube. So this is the function of the fallopian tube. So what may be the issues which are involved when we say tubal factor infertility? So if by any infection or any reasons like endometriosis, tuberculosis, pelvic inflammatory diseases, the tubes can be blocked. So what happens is there might be some exudation or some secretions because of infection, which can cause the blockage in the tube, and later on the healing may happen with the fibrosis. So in that case, what happens is the tube gets blocked. So egg and sperm cannot meet in the body. So how do we diagnose the tubal block is, there are different techniques to diagnose the tubal block. So one of the most commonly used and the oldest method is hysterosalpingogram, HSG or hysterosalpingogram. So what is done in an HSG test is, it's a radio opaque dye which is pushed inside the uterine cavity from the vagina. This dye goes and lines the uterine cavity, follows through the tube, and spills out of the free ends of the tube into the abdomen. And then the X-ray is clicked. This X-ray then will tell us the shape of the uterus, how the uterine cavity is lined. We can see the shadow of the fallopian tubes, the dye passing through the fallopian tubes, and we can see it freely coming out from the fallopian tubes. If we see the free spillage on both sides on the X-ray, the tubes are patent. So this is HSG. What is the other method to diagnose about the tubes is saline salpingography, which is a type of sonography where we use a saline solution inside the uterus, and same way it has to pass through the tubes and come out of the tubes, and we do a ultrasound by keeping a vaginal probe. So that is about saline salpingography. Another way to detect if any problem with the tube is by laparoscopy. Usually we don't advise laparoscopy only for diagnosis purpose because it's an invasive procedure. So along with diagnosing, if we have to treat surgically any particular condition, then even at laparoscopy we can check the tubes by putting in a methylene blue dye, which is a blue colored dye. We push in the dye from the uterus and it has to flow through the fallopian tubes and come out. So these are the different tests which are used to diagnose the tubal block. So what other problem can be with the tubes? There might be a collection of fluid in the tubes, which is called as hydrosalpinx, or there might be blood collection in the tubes, which is called as hematosalpinx, or pus collection in the tube, which is called as pyosalpinx. So all these things which are collections in the tube can be diagnosed on ultrasound, and these conditions usually happen as a sequelae of some infection, or sometimes with the even hydrosalpinx may occur even in endometriosis. So these are the different commonly seen findings of the fallopian tubes. So what happens in hydrosalpinx, hematosalpinx or pyosalpinx is, because the tubes are filled with these fluids, they are not functional. Also, the presence of fluid or blood in the tube causes damage to the inner lining of the fallopian tube, which causes the damage to the hair-like processes inside the fallopian tube. So even after some time, if the hydrosalpinx may disappear, the tube may not be functional, because the damage might be permanent, which may make the inner lining bald of the fallopian tube, and it may not be able to transport the egg. So these are the problems with the fallopian tubes. So what do we do for such things? If any active infection is present, like tuberculosis, which may be diagnosed on HSG or by endometrial biopsy, or along with that, if at all any laparoscopy is performed, the biopsy of the tubercles, then we advise to take treatment for tuberculosis, which may be from 6 to 9 months based on your reports. So this is for the treatment of tuberculosis. Other infections which can cause this are sexually transmitted infections like chlamydia or gonorrhea. So these infections are treated with a prolonged course of antibiotics. Other than that, if the cause for the tubal damage is endometriosis, then depending upon what kind of damage, we take the decision. Suppose if hydrosalpinx, hematosalpinx or pyosalpinx is present, means the collection in the tube and tubes are not functional, then we advise to undergo a laparoscopic salpingectomy or delinking procedure. So what we do in those procedures is we disconnect the tubes from the end where it is connected to the uterus. So this fluid collection doesn't enter the uterine cavity and disturb the pregnancy. In the presence of hydrosalpinx, if we proceed with an IVF embryo transfer, the chances of success reduce by 50%. If somebody conceives a pregnancy, the chances of miscarriage double in presence of hydrosalpinx. So having an hydrosalpinx which is diagnosed, it's always better to undergo a laparoscopic salpingectomy or delinking procedure before undergoing a transfer. If there is a tubal block which is seen on HSG at the cornual end, then sometimes it might be considered because of the tubal spasm. So in that case, sometimes what they may do is they might pass a fallopian tube catheter through the tube, so that these cornual blocks can be opened, and then they see that dye is passing through the tubes. So only the corneal blocks which are present can be helped with FTC, which is fallopian tube cannulation. So this is about the tubes. If at all you have had a history of ectopic pregnancy, then there might be a chance one of the tube may be removed, or some surgery is done to keep the tube in the body, but it might be still damaged. In that case also, whichever side tube is not present and you want to go for the treatment, if the other side tube is normal, and then you can go for treatments like IUI when you ovulate from that particular ovary. But you have to understand the success rate of IUI, which is around 15 to 20%. Also, you have to understand, for somebody with a history of ectopic pregnancy, there's always a risk of having repeat ectopic pregnancy higher than the general population, which might be somewhere around 15 to 20%. So with the history of ectopic pregnancy, if you're conceiving naturally or with an IUI, you have to immediately report to the clinic once your pregnancy test is positive and get an early scan done to rule out repeat ectopic pregnancy. So this is about the tubal factor of infertility. I wish you all the best. Thank you so much.